Thank you very much. Hello there, class of 2013. I'm grateful for the chance to join you as you mark the end of one endeavor and the beginning of all the rest that will follow. And first, I'd just like to say how grateful I am for this honor and also for the beautiful tribute that was just read. I'm here, though, not to win an honor so much as to speak to the graduating class. The sorts of exhortations that I usually make, which ask graduates to think often and deeply about the lives of others near and far, would not seem necessary at AU, which counts students from all 50 states in this country and from 130 others. Not necessary to counsel you to lift your eyes from your own lives and campus, to contemplate the broad world around you when your largest undergraduate major is international studies. Not necessary to remind you of the great challenges in the pursuit of healthcare here and elsewhere, when out there before me, draped in blue, sit the graduates of AU's first public health program. Where are you, public health people? Not necessary, I see, after reading the titles of the doctoral dissertations that are about to result in doctoral degrees. God bless you all for getting through that. And not necessary when the student speaker is Mariam Sameh Aziz, whose engagement and activism and her intellectual journey here have led her to Egypt and Haiti and Ghana and parts of the District of Columbia not well served by the systems of social protection I so often talk about. So you don't need me as your graduation speaker. Instead of exhortations or advice, you will get a story. It's a tale of two cities, Boston, which you know, and Mirebalais, which is in central Haiti, and from which I just returned, along with a couple of my coworkers here today. It's a story about the importance of the safety nets that we must not take for granted, as everyone in Haiti knew or learned again during the 2010 earthquake. But let me start in Boston, where I began my medical and doctoral studies 30 years ago. That would be qualifying as one of the old people who you disparaged, Mariam. Many of you have been thinking and praying about the city of Boston and of those lost or injured at the home stretch of its annual marathon. April 15th was a tranquil day, at least for such a massive sporting event, until suddenly there were hundreds of injuries, many severe, and they all happened at once, which is ever the case with bomb blasts and disasters less subject to human control, such as earthquakes. You have all imagined or contemplated the scene. Now imagine it as a patient or a doctor or other provider of medical care. George Packer described the bombing's aftermath in The New Yorker of 2 weeks ago, and I quote, "In the minutes, hours, and days after the blast, everything seemed to work. People knelt on the pavement and used belts or scraps of clothing to tie off tourniquets and prevent the maimed from bleeding to death. A pediatric resident who had almost finished the race jumped over the barricades and evaded the police to tend to victims. Volunteers instantly transformed the medical tent behind the finish line into a triage station. A man who had just lost his own son in the Iraq War rushed a young man whose lower legs had been blown off to the tent, and so kept another father from losing his son. Ambulances made their way quickly through the chaotic streets in minutes. Staff at Boston's hospitals quickly and methodically prepared to receive mass casualties and began operating on the injured within half an hour of the blast, preventing any more deaths after the first tragic 3. End of quotation. Now, Boston law enforcement functioned well too, but my point today is that our teaching hospitals did a splendid job that day and in the days that followed. Not a single patient who made it to a hospital died. Since we live in a period when so many things in America don't work, George Packer continues, it's almost strange to find so many institutions and individuals meeting our highest standards. In other words, there was, in addition to heroism and compassion, a system in place in Boston's hospitals. It worked. Shortly after these events, I was consulting with George Dyer, a Brigham orthopedist, and we may have need of them today, given the height of some of the shoes I've seen among the graduates, about a patient with a possible bone infection due to an injury unrelated to the bombings. But I did ask him how he and his team were doing in their wake. I knew they'd been working long hours from April 15th on to respond to the spike in demand for trauma care, and was grateful for the attention he turned to every case, including the patient we were discussing. I'd come to expect such attention at the Brigham and in Haiti, where Dr. Dyer has often volunteered since the earthquake. He wrote back, "We had the largest number of serious injuries, as it turned out. I'm still working on one of them. Probably 2 more operations to go. I was proud of how well the Brigham managed the patients, and most are doing well, at least physically." Knowing I was headed back that same day to Haiti, Dr. Dyer added the following: "This was a small disaster in the scheme of things. It made me think again how important it is to have clear plans in place for Haiti's next big disaster and the role HUM will play in it." The acronym HUM leads me to the second city in my story. The U stands for the same thing it does in the acronym AU. The H stands for hospital, and the M stands for Mirebalais. I first went to Mirebalais. Where are the seniors, undergraduates sitting? I'm supposed to have done my homework ahead of time, as I usually do. I first went to Mirebalais in 1983. This year, after college and before medical school, changed my life. It is the very year so many of you are about to begin today. I learned a lot. The need for a better system of care was evident from the start of our collective efforts there, humble as they were. It's why we founded Partners in Health. In our first few years of a health survey in the area, we lost 3 of our close friends and coworkers. That was almost half of our team. All of them were more or less my age then and your age now. They were as enthusiastic about introducing health services to their region, and not one of them lived to see 30. I sometimes get the orders of their deaths confused, not because it was such a long time ago, but rather because they're still so painful to think about. Asefi died of cerebral malaria, misdiagnosed as a psychotic break. She died sitting in a psychiatrist's waiting room. Another, Michelet, was felled by typhoid fever, complicated by an ileal perforation. Microbes ate through his small intestine. He was taken too late to the operating room and died in a busy referral hospital, writhing in pain and fear, well-founded fear, while waiting for surgery. The first to go was named Marie-Thérèse, but everyone called her T-Tap. She died of peripheral sepsis days after delivering a baby boy who was with us in Mirebalais just 2 days ago at this new hospital, which I will describe shortly. She was lost to a disease rare in places like Boston, since doctors and midwives learned to wash their hands properly before and after each delivery, and almost never registered in such settings after the advent of modern infection control and antibiotics. In every sense, 3 pre-modern premature deaths. Each of these young people, my friends, lived in the town of Mirebalais, which did not figure until very recently on any map of modernity. I mentioned that HUM is the acronym for Mirebalais University Hospital. There's not really a university in Mirebalais, not yet. But HUM was built to be a teaching hospital because the hypothesis is that the quality of medical care will be improved whenever training and research, the feedback loops that allow us to learn in a place like AU as well, occur in tandem with compassionate care. Now, I love working at a great Boston teaching hospital. I love being able to train the next generation of physicians and nurses. I love that the Brigham has large teams able to respond to complex emergencies, which in many parts of the world are unattended and result in death. Up to half of these could have been averted, we learn, with proper medical care. I love the collegiality between and within teams of caregivers who know, even when they protest to the contrary, that they have adequate time and resources for the sickest patients, the toughest cases, like those injured just last month after the marathon. I love not having power outages or stockouts or strikes or anything that might interrupt patient care. I love that there are backups and redundant and hidden systems that work, and even the ability, when overwhelmed, to bring in more resources. I love practicing medicine at a Harvard teaching hospital, and I want Haiti to have something like it too. In recent decades, such aspirations have been derided in public health, especially by those tasked by self or other with serving the poor. Teaching hospitals are not cost-effective, not sustainable, not a wise use of scarce resources. They're a black hole doomed to fail in settings of poverty and privation. So why is our university hospital now up and running? Why did we just gather in Mirebalais for a celebration of partnership? Because a lot of builders and supporters in Haiti and in Boston and in Washington and across this country and a handful of others rejected low-ball aspirations for people living in poverty. To raise that hospital in central Haiti required rejecting cynicism, defeat, paralyzing anxiety, and a host of common, indeed university-registered emotions. It required the support of thousands of people, the great majority of them not doctors or nurses or hospital administrators. It required the support of thousands and tens of thousands of students in this country, and indeed people who believed that it was necessary to have some high-quality institution for the delivery of care in a place that had never enjoyed it before. It required a commitment to building through partnership and solidarity. And that is my message here today. We can all learn to be builders. Granted, we have a long way to go to make a hospital like that function as the Boston hospitals did after the bombings, and we have a long way to go to make this hospital part of a public system rather than an island of expertise and new equipment surrounded by a deep moat designed to keep people out. But whatever happens next, the hospital stands as a monument to expert mercy and human solidarity because those who came together to build it accepted responsibility for the well-being of their fellow man, woman, and child, not because they know them, as I did, Asefi and Michelet and TTAP, but although they do not. This tale of two cities is meant to inspire and instruct. Who isn't inspired when people come together after tragedy and build something better after it. Both of these events in Boston and Mirebalais came to pass very recently in your final days as AU students. For those of you graduated today. But I hope, too, that those of you sporting the funny hats note that when I was precisely your age and wearing that Hogwarts gear, I was already headed within that very year to these two cities of Mirebalais and Boston. But I didn't know that, sitting in my folding chair, waiting for the speeches to be over. Don't worry, this one is ending. I know that you too will start off on paths that will lead to unexpected engagements. Some of them, like your friendships made here with fellow students and faculty, will last a lifetime. I'm here today, for example, because my goddaughter is a student at AU. Like her mother, who is sitting right here in the audience, Maureen is a builder. Who knew that her path would also lead from Haiti to Boston and back again when she again joins us shortly to help build in Haiti? A close friend of mine recently asked Maureen if she resented the fact that her mom, who has worked assiduously for Partners in Health for more than 20 years, was so often absent. No, Maureen replied, I hope to do the same myself. Here is a good time, the third, to ask me to join you in wishing all the moms here or listening a happy Mother's Day with a hearty round of applause. I'm also here today because I know Martin Luther King was right when he told us the year before his death, by martyrdom, that anyone can be great because everyone can serve. All of us can serve by helping to build or support the safety nets our species need. Species needs. I mean, I think most of us agree with the same species. Somebody likes my humor out there, and I'm grateful for it. It's hard to do this, bombing death thing, and anyway, never mind. All of us can serve by helping to build or support the safety nets our species needs. Not everyone affected by injury or illness survives. As I learned in Haiti during my first painful years after college, and again in the course of clinical practice and after the earthquake. This was true in Boston last month, too. It's been true in Egypt. It's been true everywhere. But how many survive serious illness or injury depends heavily on what sort of safety net we build for all those who share our neighborhoods, cities, states, nations, planet. Note that only the last of these needs no plural. We have only one planet. In concluding, it's a beautiful planet for some of us and needs to be for all of us. I thank you builders in the class of 2013, and indeed all of you who helped to construct a more compassionate and just and safer world. Congratulations and good luck. Thank you.